All right. So in this part, this is part 5. We're going to be looking at abdominal pelvic regions and quadrants. We're also going to look at some directional terminology, so describing the direction and the location of different structures in relation to each other. And we'll also talk a little bit about planes of section, so how we can divide the body into superior and inferior and medial and lateral halves and or, left and right halves and different things like this. Okay. All right. So when we're talking about abdominal pelvic regions, the reason that this is an important topic is because when you're doing an assessment on a patient, you're working in the emergency department, you're working on an ICU or something, and you have to assess your patient. You're going to assess the different areas of their body. You may listen to their heart, listen to their lungs, listen to their bowel sounds. And depending on where you hear certain things, or where they're complaining of pain, or where they have an injury, or where they have a cut or something, you can begin to think, okay, because this thing, this injury, they're having pain in this area, these things could be involved, right? So you have to know the regions and the quadrants themselves, but then you also have to know what structures you can expect to find in those quadrants. Okay, so when talking about regions, there are 9 regions. Okay, and they're named very descriptively. Okay, so if you can learn these terms, then you'll be able to identify where they're located. Okay, so first one is called the epigastric region. Okay, so the gastric area just refers to the kind of middle of the stomach area where we kind of think of the stomach. And the term epi just means on top, right? So the epigastric region is the region above or on top of where we would expect to have where we kind of think of our stomach as being, okay? Now, um, so it's kind of right where you think of your sternum is. If you just keep going down to where you get to your abdominal region, there's your epigastric region. We have parts of our liver, we have parts of our pancreas, parts of our stomach, and then maybe a little bit of our um, duodenum, which is part of our small intestine. Okay. If we go just inferior to that, we get to our umbilical region. If you think of your umbilicus, your belly button, this is that region there. Okay. So it's named your umbilical region. We have parts of our large intestine. We may have part of the stomach, and we'll have parts of our large and small intestine there as well. Okay. You go just inferior to that, so go epigastric region to the umbilical region, and then just below the umbilical to the hypogastric region. Hypo means below, right? This is where we have our hypogastric region. So we're going to have parts of our bladder, so parts of our um, reproductive system for females, and then parts of our urinary system as well. So parts of our bladder, ureters, if you're a female, your uterus and your ovaries, and then parts of our sigmoid colon as well. So this is our kind of sigmoid colon kind of wrapping around here, and then it will transform into our rectum coming down. Okay, so those are 3 regions. Those are right down the midline. Okay, and then if I can go to the next slide here, we have hypochondriac regions, lumbar, and iliac regions. Okay, so the term hypochondriac, we already know the term hypo means below, right, from hypogastric. Chondro, and we'll use this term a lot in this course when we get to histology a little bit, when we get to skeletal system and in lab. The term chondro means cartilage. All right, so hypochondro or hypochondriac is referring to beneath or inferior to cartilage. Well, what cartilage are we talking about? Well, it's actually our costal cartilage. The term costal means rib. Okay, so here we have our ribs. If you look here on this image, here's our rib. This one in yellow, these structures in yellow, this is the actual bone. So this is the actual rib. And then this one you see kind of in this lighter kind of white or kind of light blue color. This is our costal cartilage. And so the hypochondriac region is meaning the region deep to, or the region inferior to that cartilage, our costal cartilage. So we're going to have our diaphragm, maybe parts of our kidney that are superior enough, parts of our liver, spleen, and then maybe parts of our pancreas as well. Okay. If we go just inferior to the hypochondriac regions, we get to our lumbar regions. Okay. Lumbar is referring to loin. This is if we were to spin this model around 180 degrees, we would see that we're in the area of the lumbar region, so the lumbar back. So this is referring to that area. We also may have parts of our kidneys here, and then mainly digestive viscera, so parts of small and large intestine. Okay. And then lastly, we have our iliac regions. Okay. So our iliac regions, we have a bone here called the ilium. And so this is aptly named the iliac region. Sometimes this is also referred to as the inguinal region, but we're going to use the term iliac region. And again, primarily digestive viscera. So a little bit of small intestine, a little bit of large intestine as well. Okay. Now for these three here, hypochondriac, lumbar, and iliac, remember left and right. So if if you're saying, you know, what could you find in the or click on the left lumbar region if you're trying to identify the left lumbar region, which is more of a lab question, but we'll just go with it. Left lumbar, it's not your left side of the screen, it's the left side of the model, right? Which in this case would be on our right side. So this would be left here, even though this is our right. This is our left, even though this is the patient's right. Okay, so again, remember your anatomical left and right, right? Okay, so those are the regions. Okay, we also have quadrants. Okay, we have abdominal pelvic quadrants as well. Okay, so these are named according to their position relative to the umbilicus. Okay, so the umbilicus is your belly button, it's right in the middle. And so there are two that are beneath that, there are two that are above that, there are two to the right, and there are two to the left. Okay, so you just put those positions together. If it's below and to the left, it's the left lower. If it's above and to the right, it's the right upper. Same for left upper, same for right lower. Okay. So these are also important because you're going to find specific organs and specific structures within these regions that we'll look at in a little bit. Okay. All right. So another very important part of looking at um, a model or looking at a patient is being able to use specific directional terms to describe structures and describe structures in relation to another structure. Okay, so these directional terms are extremely important. And again, remember, it's in the context of anatomical position. Okay, so superior, inferior, medial, lateral, anterior, posterior, midline, all these different things. Okay, so you can see the descriptions and the definitions of what these are, and then examples of them. Okay, and so we will we'll look at some of these in just a little bit. Okay, so if we look at something like anterior, okay, anterior is meaning toward the front. All right, it's also termed ventral. Okay, we said usually we use the term ventral and dorsal for things that are maybe walking on four legs, that are quadrupeds, but you can use it. So just know that in humans, when we're walking upright and we use the term anterior, that's the front. So if you're looking at me, you're looking at my chest, that's the anterior part, right? That's also the ventral part. However, if I was walking on four legs, instead of facing forward, my chest, the ventral area or the anterior part, it would now be facing toward the ground. Okay, so ventral could also be facing down toward the ground. Dorsal would be facing up toward the sky, or if we were standing upright, it would be facing posterior or facing behind us. Okay, so when we look at posterior here, we can now see posterior is going to be toward the back, right? The heart is posterior to the sternum, so your sternum is your chest here, that chest bone in the front, and just behind that or posterior, deep to that, you have your heart, right? Um, we also have the term dorsal, as we said, which is referring to the the backside of something or the backside of the body. Okay, so here we're looking at the backside of an individual, so we're looking at their dorsal aspect or their posterior aspect. Okay, you can also refer to muscles in this context as well, right? So a posterior muscle in this case is on the backside of the body. So our gastrocnemius or the calf in this case, it's been injured, so we have a posterior or dorsal compartment injury. Okay, now we can also refer to structures where they are located relative to the midline of the body. So the midline, imagine you were able to cut the body in equal left and right halves. Okay, perfectly equal left side to perfectly equal right side. That cut is in the midline of the body. Any structure that is closer to that cut is termed medial. And as we'll see in the next slide, any structure that is away from that line is termed lateral. Okay, so toward the midline, nose is medial to the ear. The nose is closer to the midline of the body than the ear is. Okay, if we look at lateral, the ears are lateral to the eyes. Ears are further away from the midline than our eyes are. The shoulder is lateral to the sternum. The sternum is right in the middle. The shoulder is a little more lateral. Okay. We can also describe structures where they reside relative to their attachment to the trunk. Okay, and this is generally going to be used in the context of your limbs, so your arms and your legs. Okay, so if we think of our arms, where does our arm attach to the trunk? Okay, well, the arm attaches to the trunk at the shoulder. Okay, where does our leg attach to the trunk? The leg attaches to the trunk at the hip. Right. And so any structure that is closer to the attachment point of that limb to the trunk is termed proximal. Okay, so for our arm, any structure closer than another structure closer to the shoulder, in this case, is going to be proximal. If it is further away, as we'll see in the next slide, it's going to be distal. Okay, so in this case, the elbow is proximal to the wrist. The elbow is closer to the point of origin on the trunk, closer to the shoulder in this case, than our wrist is, right? The wrist, you could say, is proximal to the digits. The wrist is closer to the elbow, or I'm sorry, closer to the shoulder than our digits are, okay? If we're talking about distal, now this is referring to further away, right? So the wrist is distal to the shoulder, right? It's further away, or wrist is distal to the elbow. The toes are distal to the ankle. They're further away from the attachment side than the other structure. So the thing with proximal and distal, and with a lot of these terms, really all of them, you have to use it um, in conjunction with two different terms. Okay, I can't just say the wrist is distal. Okay, because the wrist is distal to some structures, but it's also proximal to other structures. All right, so you have to be specific about what you are referring to. Okay, I can't just say the sternum is superior because the sternum is superior to some things, but it's also inferior to other things. All right, so we have to be very specific there. All right, all right. Superficial and deep. This is another important uh, set of terms. These are referring to things where they reside relative to the external aspect of the body. So if they're near the surface, near the outside, that's a superficial structure. If it is deep within or further away from the internal or from the external surface, body surface, then that is considered a deep structure. Okay, so the best way to look at this and think of this is to look at different types of injuries. Okay, so we're going to look at some superficial and deep injuries. Okay, and now I have a personal connection with both of these because one of these is my hand and one of these is my father's hand. So look at these. So would you categorize this injury as a superficial or a deep injury? What would you say? What would you say? Superficial or deep? So right here on the fourth digit, on the dorsal aspect, you have two small cuts here. Okay, so I cut my hand while I was doing dishes. All right, so you have one cut here, one cut here. These are relatively superficial, right? They're not very deep. It bled, but it didn't cut through any tendons. It didn't do any major damage. Okay, didn't need stitches, didn't need anything like that. Just clean it, put a Band-Aid on it, and it's fine. Okay, what would you say? What would you call this injury here? So this is my dad's finger, right? He was cutting a piece of wood and cutting a long sheet of plywood and accidentally ran the blade through his third digit, so through his middle finger, through that kind of distal aspect. So you can see here is here's part of the nail here, here's the remainder of the nail right here. Okay, so you would probably categorize this as a deep injury, right? It went deeper into the body. There's obviously lots of blood. In contrast with my very superficial injury. Okay, so you can use this to describe injuries. You can use it to describe cuts, or you could also use it just to describe different structures throughout the body. Okay, all right. Now we can also talk about how we can divide the body into different compartments and different sections. Okay, so whether we divide the body into superior and inferior, whether we divide the body into left and right, whether we divide it into front and back, we can give these different names. Okay, so first one is a coronal or a frontal plane. Okay, so imagine a pane of glass comes straight down to the top of your head and it cuts you into a front part and a back part. Okay, that would be a frontal plane. Okay, now we're gonna technically say the frontal plane divides the body into an anterior and a posterior. Okay, it creates a front, quote unquote, anterior, and it creates a back, quote unquote, or posterior. Okay, you can view both extremities. You can view abdominal contents as well. Okay, so this is a frontal or a coronal. So imagine the term coronal means crown. So imagine when you set a crown on your head, uh, if that crown were to continue down and it was straight and it could cut your body in half, it would cut it into a front and a back, or anterior and a posterior. All right. We also have a transverse plane. Okay, this is generally what we think of as like as a horizontal plane or like a cross section. Okay, so we can divide the body into a superior and an inferior, right? So think of the term transverse with a T creates a T, it creates a top as well as a bottom. So superior and inferior aspect. So if we cut the body in half like that, now we have the top, which is no longer there, and now we have a bottom as well. Okay. We also have sagittal plane. Okay. Now there are two types of sagittal planes. Okay. There is a mid-sagittal and there's a parasagittal. Okay. Mid-sagittal, and the only difference that exists between these two is whether or not you divide the body into equal left and right or unequal left and right. Okay. So a mid-sagittal divides the body into equal left and right. So obviously this has to go right down the midline of the body. Okay. Parasagittal divides the body into left and right, but unequal left and right. So this is called parasagittal. The term para means beside or to the side of. So this is to the side of the sagittal plane or the midline, which divides the body into equal. Parasagittal is unequal left and right. Okay. Now these so think if we cut it in half like this, we divide it into um, left and right. And then lastly, we have our oblique plane. So oblique is referring to an angle or kind of diagonally. So if you look here, if we took a section out of this calf, we took it front in an oblique plane, you can see that it is at an angle. We also have oblique muscles, and these are called obliques because their fiber orientation is running at an angle relative to another muscle here called the rectus abdominis, which is running perfectly up and down, and relative to another muscle, which is called the transversus abdominis, which has muscle fibers running completely horizontally. So these are running at an angle to both of those, so they're termed obliques. Okay, we'll look at obliques in lab when we get to muscular system. Okay, so all of these planes and sections, whether it's frontal, coronal, sagittal, you know, transverse, oblique, whatever it may be, these are important for you to know because different types of imaging in a clinical context will section and take pictures of the body and then piece them together in these different planes. And so you have to be able to orient yourself to what what context you're looking at the body in. Am I looking at the body in a sagittal section here? Is this a frontal or coronal section? Is this a transverse or horizontal section, like a cross section? How am I looking at the body? And then you can begin to look at the structures and begin to identify things. But you can't do that if you're not sure what section it is you're actually looking at it. Okay, am I looking at the front, the back, the left, the right? What am I looking at? Okay, all right. So we will stop here and we'll pick up probably with our last part by talking about some homeostatic set points, and this is a very important topic for our course.